On this episode of the Ask Mike Reinold Show, we talk about movement versus joint-specific rehab programs. We talk about the trend towards anti-movement core exercises, and we talk about our essential reading list. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I am here at Champion PT and Performance up in Boston. We are here to answer some of your questions that you guys submit to us. So thanks so much for all the great questions. Keep them coming. We love it. I'm here with Lenny Macrina, Dave Tilley from Champion, and our students are here from Sac State. We have Evan, and from Kentucky, University of Kentucky, we have Jake and Bake. So let's roll, Evan. Let's get into this episode.
All right, Mandy from Wyoming. I have only been out of school 4 years and I'm currently finishing up a fellowship in manual therapy. I work in a large clinic with 12 other PTs and I'm struggling with low back evaluations that are done by some of the younger clinicians. They seem to be very enthralled with SFMA and other functional assessments but forget that there are actual joints in the low back. What is your advice when trying to discuss what I see as a lack of screening? I like the SFMA, but I wonder if it is a better screen for after you get the patient 3 to 5 sessions in.
I got this one. This is something I definitely struggled with as a new grad. Because I took the SFMA 2 months after graduating, after I felt like I wasn't really getting everything. And then I took McKenzie and another course like a month after that. And they were very much kind of in different ballparks. So personally, I think that you can do stuff for the pain at their low back, whatever's symptomatic, and you can still pick away at the SFMA around the problem. So
You don't have to wait 3 to 5.
exactly. I found very commonly I was doing whatever symptomatic modality, soft tissue work I could do on their back, and I was going a McKenzie route at their back maybe. For me, that was personally what worked. And then in the meantime, maybe there's an exercise for the T-spine, there's an exercise for the hip, if they can tolerate it in a non-weight bearing position, and it worked extremely well. It wasn't like I have to be only SFMA, I have to go pain management modality, symptom relief, whatever, McKenzie. You can do both if you have a good assessment.
Well said. It sounds like, too, is this Courtney? Is that what it was?
Mandy from
Mandy,
Wyoming.
I was close. So it sounds like Mandy probably needs to, I think you both probably need to open your minds a little bit here. I think Mandy needs to probably learn more of the movement assessment stuff so that way she understands and appreciates it. Because right now, I think you're speculating a little bit. So Mandy should probably learn that. But then I totally agree that the students need to learn how to treat joints.
Right.
You got to put those together. The students are definitely getting caught up now in too much of these systems that are out there, and too little into actually how to treat joints and stuff like that. So I'm on board with that. I agree.
I would just say one more small piece is you have to know when to push and when to not push. So perfect example, error I made, I was breaking out the MS flexion breakout, and I'm like repetitively kind of doing leg raise tests and flexion and low back flexion. I'm like, oh, maybe this is an SEMD, and I was kind of flaring them up as I went. If you listen to them say like touching my toes and sitting in the car hurts, like maybe we won't break out flexion today. The SFMA says that, but I was like, oh, I got to run the SFMA. Let's see what they got.
Yeah. It sounds like they both work better together, and I think the SFMA just looks at your movement. It doesn't tell you necessarily what to do. Mm-hmm. So you need to know how to treat underneath that. So I think there's deficiencies on your students' part as well, though.
No, so
Love it. Jake and Evan 11. Sorry.
All right. Daniel from Chicago. Past 6 to 8 years have seen core training move away from isotonic exercises and towards anti-flexion, extension, rotation, isometric-based exercises. Do isotonic core exercises still have a place in your programming for athletes? Also, it would be interesting to hear your explanation of why the strength and conditioning community has moved away from this and more towards the anti-flexion, extension, rotation approach.
I'll start by answering the second half. Is the internet's a powerful thing, right?
Yeah.
I think the trend towards anti-movements, I think it's a fantastic trend. I think Stuart McGill probably championed this more than anyone at the beginning, and then others kind of followed suit. But the internet really rolled with it, and then what gets exciting on the internet tends to the pendulum swings, and it looks like it's super exciting when it's probably not as exciting as it is. I think anti-movement core exercises are foundationally what you need, and I think that's very super important, but there's definitely movements of your core that you need as well. So I think it's wrong to just do one thing. I think you got to put them together quite a bit. I mean, just imagine doing like a rotary medicine ball throw. I mean, that's an isotonic core to an extent, don't you think? So we definitely want to do rotational based stuff. So I know we use the anti-movements as our foundation, as our beginning, and then build upon that, but it's often because we're trying to train how to stabilize the core and move the extremities, and that's an important component to that link. So I think that's why we start that way quite a bit. But I think avoiding it completely is probably also wrong. But like the McGill, people really took McGill to an extreme, right? And like I feel like people got afraid to do anything for a while. What's the latest thoughts on that? What do you guys think?
Yeah, I mean, I agree with what you said, that we build a foundation and then we're just promoting movement. Obviously I'm keeping an eye on pain and just giving the client confidence that they can do the exercise and watching them move and just coaching it through it. All this other stuff, I almost used a bad word, all this other stuff is just fluff that make people sound intelligent. So, I'm not against McGill. I think he's got some great stuff and I use it in the back of my head. But I think just movement is a simple movement. I guess I keep things way too simple than what the internet is. I have a boring rehab philosophy, I think, compared to what's out there. So I'm probably the wrong person to ask.
I feel like we almost created a trend towards being afraid to move.
Yeah.
Which is probably not great for the way people interpreted that. But again, it's because things become very, very sensationalized on the internet. Right. So it's it's all about how you put that together.
Yeah. I think people have to remember the reality of the situation is that you don't walk around, only not moving your back and moving your arms around it constantly. It's like we just go about our daily life, and even just sitting here, all of us are kind of like doing different stuff. It's not like you're just rigid in a pattern that you have to be like, I have to always brace my core and hip hinge to grab this off the floor. We're a little bit more resilient than that, so we can't be afraid of stuff.
Love it. Yeah, no, I think that's good. Perfect. Evan 11, what's next?
Frank from Denver asks, any recommended readings for those aspiring to become physical therapists and also be involved in sports?
Oh, easy one, right? I have, for recommended reading, I have an article on my website, an essential reading list that you can find. It's actually a little old. I probably need to update that. Didn't you just kind of do that?
Just did one, yeah.
Yeah, and then Dave Tilley on shiftmovementscience.com.
Mm-hmm.
Right?
Yeah.
Perfect. Shiftmovementscience.com. I think you just released that too,
it's
right?
like all mine from the last year and a half, and then a bunch of Audible books I've been reading.
Yeah, there's a bunch. I mean, it's really hard to say. I don't even know what to tell you to read first, to be honest with you. It's a big list. But, I think it depends on what you're most interested in right now. So go check out our reading list that Dave and I have published and see what piques your interest, I think, first.
I think what's relevant to your population.
Yeah, exactly. Your interest in what you do all day, right? And start reading. I think those will be helpful. So. Awesome. Was that 3? That was a quick one. We made a quick one, that one. Awesome. Well, thanks, guys. We really appreciate it. Thanks so much for everything. You guys can ask us more questions on MikeReinold.com and click on the podcast link. And be sure to go to iTunes and subscribe. Leave us a nice little review. We actually read those and learn from those. So, tell us what you think of the show. Give us some feedback so we can make it better for you down the road. So, thanks so much. We'll see you guys on the next episode.